If you want to strike terror in someone's eyes, tell them they have rosacea. But what an unfair bad rap that diagnosis has. Stay tuned, and I'll tell you how rosacea's bark is much worse than its bite. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Rosacea is one of the few diagnoses in dermatology that has an awful social stigma attached to it, bringing paralyzing fear and anxiety to people who think they have it. That's probably rooted in the infamous bulbous and distorted nose of W.C. Fields, the most famous rosacea sufferer who had an exaggerated form of Rhinophyma, a rare complication of rosacea. So rare that in 30 years I've only seen 2 patients with Rhinophyma. So let's get past the ungrounded fear and anxiety and explain the reality of rosacea, which is almost a hybrid between acne and eczema, with the inflammatory red pimples and cysts of acne and the skin sensitivity and inflammation of eczema with disproportionate redness. When you have the pimples and cysts, it's called acne rosacea. But unlike regular acne, instead of blemishes predilecting your T-zone and acne rosacea, they're mostly on your central face, on and around your nose, the central parts of your cheeks, and the lower forehead. When you have only the eczema part, the skin of the central 2/3 of your face, or even your entire face, is pink or red with red blotches or red spider veins, or even both. It feels sensitive and can even be swollen or flaky. In severe cases, the eyes and eyelids can be affected. Rosacea tends to be more common in pale-skinned people of Celtic, Northern, or Eastern European background. It usually starts in your 30s, 40s, or 50s, and it's not seen in people with dark skin. In people who have rosacea, certain factors aggravate it. Some of the most important are unprotected sun exposure, alcohol consumption, stress, cold weather, exercise, many foods such as spices, hot beverages, and dairy, and even certain skincare products. While rosacea can't be cured, it can definitely be controlled by oral and topical medications, lifestyle modifications, all of which I'll discuss in the DermTV episode on the treatment and control of rosacea. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.